Did you know that some very common medications can quietly blur your memory every single day? If you're over 60, this information could determine the quality of your memory for the next 10 years. Many people take this medication for years until they discover they've been silently raising their risk of dementia. 1. The risk from anticholinergic drugs in daily life. Many people are using familiar medications for allergies, insomnia, anxiety, depression, overactive bladder, or irritable bowel syndrome without realizing they may carry a hidden but serious risk. This group of medications is called anticholinergics, and studies have shown that if taken daily for 12 consecutive months, the risk of dementia can increase by up to 50%. The danger lies in how these drugs work. Anticholinergics block the action of acetylcholine, a key neurotransmitter that acts like a spark, allowing brain cells to communicate. When acetylcholine levels drop, nerve signals weaken, similar to cutting off power to part of an electrical system. This directly impacts the brain's ability to remember, focus, and process information. Long-term use of these medications not only weakens brain function but can also cause structural damage. MRI scans have shown that long-term users tend to have brain shrinkage in areas related to memory and cognition. This explains why they are more prone to symptoms such as forgetfulness, disorientation, or difficulty communicating. What's concerning is that many people don't realize their medication belongs to the anticholinergic group. Some older generation, allergy medicines, sleep aids, antidepressants, or bladder medications fall into this category. Therefore, self-medicating or overusing these drugs, especially in middle-aged and older adults, can significantly raise the risk of cognitive decline. A safe approach is to always consult your doctor or pharmacist before taking any medication. Long-term, if use is necessary, ask about the minimum effective dose, the shortest possible duration, and safer alternatives. Additionally, maintaining a healthy lifestyle with a diet rich in vegetables, regular exercise, adequate sleep, and mental stimulation can help protect memory and reduce the harmful effects of medication. 2. Common medications in this group. These commonly used drugs share one thing in common. They contain anticholinergic compounds, which can affect the brain and memory, especially with long-term use in older adults. Here are some frequent categories and examples. Allergy medications. Benadryl diphenhydramine is an antihistamine that relieves sneezing, itching, and runny nose. However, it also has strong sedative effects and can cause drowsiness and reduced focus, posing risks if the user needs to drive or operate machinery. Over-the-counter sleep aids, Tylenol, PM, Unisom, are marketed as quick fixes for insomnia. Most of these contain diphenhydramine or doxylamine, both of which can impair memory and alertness with long-term use. Anxiety medications. Hydroxyzine visceral atarax is prescribed to reduce anxiety, stress, or help with sleep. However, it's also an anticholinergic and can cause side effects like dry mouth, dizziness, and confusion, especially in older adults. Bladder medications. Diazepan, Detrol are used for urinary urgency, incontinence, or overactive bladder. They relax bladder muscles but can also cause constipation, blurred vision, and confusion. Irritable bowel syndrome, IBS drugs. Bentyl reduces intestinal spasms, easing abdominal pain and diarrhea. However, it's an anticholinergic and can cause central nervous system side effects. Motion sickness patches. Scopolamine patches are often used for long trips by boat, ship, or plane to prevent nausea and dizziness. While effective, scopolamine can also cause blurred vision and confusion, particularly in those over 60. Importantly, These drugs, whether taken alone or in combination, can increase the risk of memory loss, confusion, and even dementia with long-term use. Adults over 50 should discuss benefits versus risks with their doctor and consider safer alternatives. 3. Scientific evidence. In recent years, a growing number of large-scale studies have confirmed the alarming link between use and the risk of developing Alzheimer's disease and other dementias. Anticholinergics block acetylcholine, a neurotransmitter essential for memory, learning, and cognitive regulation. They are often prescribed or even available without prescription for allergies, insomnia, depression, urinary disorders, or digestive spasms. Multiple meta-analyses involving millions of participants worldwide have consistently found that long-term anticholinergic use is clearly associated with a higher risk of Alzheimer's and dementia. Some long-term studies show that taking them for just over 3 months can increase average risk by 46% compared to non-users. This risk is even higher in older adults or those with existing neurological risk factors. Evidence goes beyond epidemiology. Neuroimaging using MRI and PET scans has revealed structural and functional changes in the brains of long-term anticholinergic users. Findings show brain shrinkage, especially in the hippocampus, the memory center, as well as impaired glucose metabolism in the brain, an early marker of These changes mirror the pathology of Alzheimer's, suggesting a direct and possibly irreversible impact on the central nervous system. Scientists hypothesize that prolonged acetylcholine suppression weakens neural networks related to memory and accelerates disease processes such as beta amyloid and tau protein buildup, to hallmarks of brain degeneration. This explains why even low doses, if taken for extended periods, can have significant effects. Based on this evidence, many health organizations now recommend minimizing anticholinergic use, especially in older adults. Doctors are advised to consider safer alternatives, and patients should be thoroughly counseled before taking these medications long-term. 4. Mechanism of harness. Choline is one of the most important neurotransmitters in the central nervous system, plays an essential role in the formation and maintenance of memory, regulation of attention, learning ability, and fine motor control. In the brain, acetylcholine is released from cholinergic neurons and binds to specific receptors on target cells, triggering a series of reactions that transmit information between neurons. Anticholinergic drugs work by blocking muscarinic receptors, a type of acetylcholine receptor. When these receptors are inhibited, the transmission of signals between neurons is disrupted. This is especially serious in brain regions critical for memory and cognition, such as the hippocampus and cerebral cortex. The hippocampus is responsible for encoding new memories and spatial navigation, while the cerebral cortex is involved in information processing, thinking, and decision. When these areas do not receive enough acetylcholine signals, the ability to remember, learn, and process information is significantly impaired. In older adults, natural acetylcholine levels have already declined due to aging. This makes them particularly vulnerable to the effects of anticholinergic drugs. A degree of inhibition that a younger person could compensate for may cause marked cognitive decline in older individuals. This explains why symptoms such as confusion, disorientation, and memory loss often appear quickly in this patient group when taking such medications. Moreover, prolonged acetylcholine blockade not only affects immediate brain function but may also promote neurodegenerative processes. Some studies suggest that sustained cholinergic activity reduction can lead to loss of neuronal connections, atrophy of memory-related brain structures, an increased risk of amyloid plaque formation and tau protein abnormalities. of Alzheimer's disease. Due to these mechanisms, the effects of anticholinergic drugs on the central nervous system, especially in older adults, are not only temporary but may also have long-term consequences. Therefore, careful consideration when prescribing and using these drugs is essential to protect long-term cognitive health. 5. Who is at higher risk? Not everyone who uses anticholinergic drugs is affected to the same extent. Certain groups are at much higher risk due to their physiological characteristics or pre-existing health conditions. First, people over 60 are the most susceptible. With age, cholinergic nervous system activity naturally declines, acetylcholine levels in the brain drop, and both the number and sensitivity of receptors decrease. Using muscarinic receptor blockers in this context exacerbates the deficiency, leading to more pronounced memory and cognitive impairment compared to younger people. Additionally, older brains recover more slowly after discontinuation, prolonging the harm. The second group consists of individuals who already have memory problems or mild cognitive impairment (MC). In these individuals, brain regions such as the hippocampus and cortex are already weakened. So anticholinergic use can accelerate degeneration, worsen symptoms, and increase the likelihood of progressing to dementia. Finally, those taking multiple anticholinergic drugs at once, often patients with several chronic conditions, are exposed to cumulative effects, even if each drug has only mild anticholinergic activity. Combined, they can reach a threshold that causes serious brain function disruption. This scenario is quite common among older adults due to polypharmacy and requires physicians to carefully review medications to avoid interactions and compounded side effects. Identifying high-risk groups early is a critical step in adjusting medications proactively and minimizing long-term effects on memory and brain health.